Hey, I'm going to show you how to get relief from your knee pain in 1 minute using just a kitchen rag like this one. My name is Dr. David Midoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please subscribe so you don't miss out on any of our helpful videos that we upload every single week. Knee pain can have so many different causes, but the most common causes share a lot of the same symptoms, and those symptoms can be relieved by just using a simple towel like this. Some of the most common problems that are caused by knee pain are knee arthritis, meniscus tears, and knee cartilage damage. Now, this trick I'm about to show you only works if you can fully bend your knee. If you can't bend your knee all the way back, then you are going to have some difficulty doing this. You might try it anyway and see how far you can get, but you have to be able to bend your knee pretty well. So here's how it works. You're going to get a towel or a kitchen rag just like this, fold it in half, and then just roll it up. It doesn't have to be perfect, just roll it up well. And you're going to put this behind your knee. And what this is doing is it's offloading the cartilage surfaces of your knee joint. It's giving the meniscus some space to breathe. It allows the compression to get off all these tissues. It helps to alleviate the arthritis. Arthritis happens from excessive compression inside your knee joint. And what we're doing here is trying to separate the knee joint surfaces using this towel as a fulcrum. Pardon the interruption. I want to tell you about our knee arthritis recovery program. This program is completely focused on fixing the root problem that's putting too much pressure through your knee joint and setting up osteoarthritis. There's 3 components to this program. The first is a curriculum. It's me walking you through the 4 phases of recovery. In the first one, that's when you're really stiff and painful and you maybe can't get around very well, all the way to the last phase where you're doing maintenance work and you're feeling fantastic, able to get around and potentially even exercise. That's a big section of the program. A second section of the program is weekly live group coaching, where me and my staff are on Zoom talking to you, answering questions so that you're never stuck. And then the third component is a private community where you can ask questions and my team is getting to you throughout the week, as well as learn from others and see their questions and their wins so you can get encouragement along the way. Go check out the program. Back to the video. So there's 2 ways I like to do this. You're going to just put this right behind your knee. Here's one way. You're going to sit and then pull your leg up against you to fully bend your knee. And just hang out here for about 10 to 20 seconds and repeat it until you've done this for about a minute. Usually you don't get that much more benefit for going longer than a minute, so a minute is usually all you're going to need. Now, if you want more force than this, an alternate way to do this is to find a bed or a chair, some soft surface that you can put your knee onto, and do the same thing. Put that towel roll right behind your knee and then just start to sit onto it. And if you can tolerate this okay and you feel like you might be able to take even more, then double it up. Get another towel. I already pre-rolled this one, and roll your towel around that one. Just like so. And do it again. See if that is a little easier on you. Now, I have more trouble doing it in this position. I've tried pulling my leg up. It's just, for me, I don't get as much force as others might. I've seen some people do okay with that. I like this one. And if you just sit on it like that, I can feel a little stretch happening in my knee, which is those joint surfaces coming apart, allowing the fluid to get into all the crevices of the knee joint. And that fluid is important because it's what nourishes the cartilage and the meniscus and some of the ligaments inside the knee joint, which don't have a good blood supply, but they do get nutrition and oxygen from the knee joint fluid. So you want that fluid to get in all the spaces. If you've been having stiffness in your knee, achiness or pain, chances are that it's coming from one of those tissues. And if you just give it a chance to breathe, literally get oxygen to it, then you can get some relief in the short term. Now, I want to stress to you that this is not going to cure your knee problem. If you're dealing with something like knee arthritis or a meniscus tear or cartilage damage to your knee, if your knee's kind of heading towards bone on bone or might already be there, this is not going to fix you long term. This is the equivalent of taking like a pain pill. This should be able to help you not take the pain pill if you're taking over-the-counter pain medication. If you've been prescribed pain medication, you got to follow your doctor's orders. If he said as needed, then this might be able to help you avoid taking that pain medication too. But you've got to look deeper at what's causing your knee problem. We talk about this at length on different videos in our channel. I've linked some videos below about knee arthritis, another one about meniscus problems, and about cartilage problems in the knee as well. So if you want to learn more about how to address your knee issues and solve a long-term problem so that you can truly avoid having a surgery someday and avoid having to rely on pain medications and injections, go check out those videos so you can learn more about solving your knee problem. I wish you the best of luck, and let us know if this works for you.